for those. I get a lot of students where English is their second language. And so it's really challenging for those students as well. So it's not just about content, but it's really about taking the exam and how the exam is administered. So again, for those of you joining us today, welcome, welcome. We are going to be talking about turning setbacks into comebacks. So this webinar is intended for those who have had some trouble passing the board's exams, whether you've passed the board or tried it once and failed or multiple times and failed. This is really a webinar where we're going to normalize talking about what that means and what our next steps are. So go ahead, you guys, put in the chat for me. I really want to hear from you. What made you join today? Where are you in your nursing journey? Are you just getting started, coming back from a failed exam, or have you tried a couple of times and you're just getting frustrated because you don't know what's going on? You're studying hard. I see that a lot from my students too. A lot of studying, overstudying. We'll talk about those common pitfalls as well. As I mentioned, if you guys are nervous about the anonymity in the chat, go ahead and put your responses in the Q&A, because then it won't have your name pop up and it'll be more anonymous that way. But we really want to normalize this because it happens a lot and people don't talk about it. We don't like to talk about it in school either. I think mostly because our instructors want to make sure you're going into the boards confident and not thinking about, well, what if we fail? And nobody wants to think about failures. But failures are a huge part of being successful, right? It's a huge part of being resilient. If you didn't have some form of resiliency, you wouldn't be in an NP program, right? This is not an easy program to get through. You probably didn't master all of your classes and you had to try multiple times. Maybe you had to try multiple times to get into NP school. That's all really great. I have kiddos and I'm really trying to allow them to fail, to really prepare them for life, because failure is part of success. So I don't want you guys to feel like you can't do this again. And it's okay. It takes a little while. Be kind to yourself. It takes a little while to get back into the mindset of studying again and getting ready to sit for the exam again. But I really want to talk to you guys about how to prepare for these exams and how to study so that you're getting the most effective study plan moving forward, so you're not just spinning your wheels. I have a question from a student. I've been putting off my exam. The student is taking the A&P. I have rescheduled it twice now. I'm afraid to fail. I'm not a strong test taker with severe anxiety. Yes, we see that a lot. You're not alone. And I've taken a predictor exam and failed that. It scared me enough to not even try to take the A&P. So that is huge. Thank you so much for your honesty. How many of us can relate to that, right? You guys, we're afraid of failure, so we're not going to try. And so for that student, I'm not going to mention any names, but go ahead and put in the QA for me again. When did you graduate? So I talk to my students a lot about making sure you feel ready taking the exam, but not putting it off for too long, right? So a lot of my students will keep pushing their test date back because they just don't feel the confidence. And I really want you guys to try the boards pretty soon after graduation, because that's where the material is really the most fresh in your brain. Now, for those of you who just are taking predictor exams and you're not testing very well, you might need some extra help. And we'll talk about that a little bit during today's webinar too, because there might be some knowledge gaps that you just aren't able to identify with these predictor exams. I do a lot of one-on-one tutoring. I do a lot of small group tutoring, and I'm really good at looking at the predictor exams and teasing out those areas, those knowledge gaps, and really creating that focused study plan. But a lot of students can't do that for themselves. So I really encourage you to reach out for tutoring, because that is going to be it's going to be a game changer for you. It's going to really help you create that focused study approach and feel like, okay, I know where to go from here, and start seeing some results, some progress on those readiness predictors. I definitely think if you are not scoring well on our readiness predictors, I can't speak to what else is out there, but if you're not scoring well on our readiness predictors, I don't want you to just study it, just sign up for the boards and take the exam, because we definitely there's some work to be done there. So thank you for that honesty. We're going to talk a little bit today about those common pitfalls for studying, what I see in my students and what I counsel them on. We're also going to talk about clinical prioritization. So when you're studying for the exam, when you're studying these practice questions, I want you to always be thinking about clinical prioritization. We'll talk about that. We'll talk about that focus study approach and how I myself and our other instructors here at Archer can help you really come up with that focus study approach. And then some important takeaways, and we'll talk about the Archer method as well. I'm getting another question. 6 months ago, I'm afraid that I have waited too long, and now it's placed more fear in failing. It has all snowballed. I'm feeling embarrassed too that I have waited too long. Thank you so much for that honesty. Yeah, I can totally understand that. The more you wait, the more that anxiety can build up, right? Test anxiety, feeling like, oh my gosh, it's been so long, I've forgotten everything. That is totally understandable. And I think at that point, you've shown up for today's webinar. Asking for help, reaching out for help is exactly what you need to do. So kudos, huge kudos for you getting back on the horse and reaching out for help. That's exactly what you need to do. So let's talk about those common pitfalls and how we can avoid them. A lot of my students, I see that they're missing questions because of a lot of overthinking, right? Overthinking, am I ready for the boards exam, overthinking the questions. This leads to a lot of second guessing ourselves, kind of tearing down at that confidence to the point where we may know the content, but we may be talking ourselves out of the right answer, right? So I see a lot of this overthinking, and I myself am really guilty of overthinking. And it takes practice to really be like, no, stop overthinking, just try it. Right. And that's almost the way I want you to answer these practice questions. Go with your initial instinct and select the answer that you think, you know what, that was my initial instinct. I'm going to stick to it. I'm not going to overthink it. You learn a lot from these practice questions. And so when you start to overthink it, you start to really confuse yourself and you start to really overread these practice questions. So I see a lot of overthinking as a common pitfall. Another reason why my students may be missing their practice questions or not performing well on these predictor exams, they're studying everything all at once. It's not focused, right? You can't possibly retain anything when you're just studying everything. And they're studying for long hours. I had a student tell me that she was studying for months, 12 hours a day, 9 to 12 hours a day, doing 175 practice questions a day. There is no way you can retain any information that way. That is tough, right? Anybody doing that is going to feel burnt out and not going to retain any of that information. So studying everything, memorizing. So instead of understanding the pathophysiology of what's happening in that disease process, why the pathophysiology behind the pharmacology, the mechanism of action, we're just trying to memorize. Memorization is very short term. You may remember it, you may be able to regurgitate it, but you're not able to use it in critical thinking. And that's what these boards questions are like. They're not going to ask you to regurgitate the information, give straight rote memorization questions. They're really going to be examining how well you understand the material, how well you can use it to critically think in a case scenario. So memorization is going to be a huge pitfall. I want to talk to my students. I really want to make sure you guys understand that it's important to understand all of the pathophysiology instead of just memorizing. So I work a lot with my students one-on-one on that. And then also reviewing the content you already know to feel better. I have students who feel like, you know what, how am I scoring so low on these predictor exams? I'm going to take one from a source that I know I'm going to score well on. Well, I would really caution you against that because those are typically the sources where the exam questions are too easy, right? And if they're too easy, they're not preparing you for the board's exams. They're not preparing you for clinical practice. And so if you review content that you already know, you're wasting your own study time. You're not gaining anything new. You're not gaining any new content or information from that. But it's also, I understand it. I'm not judging it. Students feel reassured by that. So I really encourage you not to do that. The whole point of studying is to tease out the information you don't know, sort it in an organized, focused way, and start chipping away at the information that you don't know and learning that information. That's what's going to really serve you not only for your boards exam, but more importantly for clinical practice. That's what I really emphasize with my patients. And then lastly, I see this a lot. It's kind of hard to tease out, but I really, when I work one-on-one with my students, I try to figure out who are the ones who are really rushing through the questions, right? These are my students that really know the content very well, but they're not scoring well on these exams. They're failing their boards exam, and it's because they're rushing through the questions. And so we're going to talk about the Archer method of really slowing down while you're studying, and it feels really uncomfortable at first. Anything new is going to be uncomfortable at first, but really slowing it down, breaking down those practice questions and understanding what it's asking so that you can actually use the knowledge that you have to answer the questions effectively and correctly. So that's really important. These are some big common pitfalls I see. Secondly, we're going to talk about clinical prioritization. So what do you guys think from your nursing world? Do you remember what are the big three for clinical prioritization when we have patients? What are those big three things that we're going to be thinking about? What do you guys think? That's right, our ABCs, right? Our ABCs of prioritization. So airway, breathing, circulation. Why is that? Why are ABCs the most important? Why are we going to prioritize ABCs? Come on, you guys are all experienced nurses. You know why. Put it in the chat, put it in the Q&A for me. Why are we prioritizing those ABCs? For safety, right? Because what happens if we don't prioritize our ABCs? What's the outcome? That's right. Patients can die, right? So the airway, breathing, circulation, our ABC. So prioritizing how to keep our patients safe. Now, most of you are studying for outpatient primary care boards exams, either the FNP, adult gerio that have joined us today. Maybe some of you are also psych mental health. We need to be prioritizing the ABCs, but how do we do it in that outpatient setting? So a lot of our nursing experience may come from that inpatient setting. What are we thinking about when we're talking about outpatient? The spectrum of stability is really important. What can we safely manage in this outpatient setting that we can't necessarily say, okay, I can monitor you around the clock when we're on the inpatient setting, right? We have a whole team monitoring those patients. What can we do in that outpatient setting to keep these patients safe? Our ABCs of the outpatient setting, right? This is when we're really thinking about the stability of the patient. Is this a patient who's stable that we can safely manage in that outpatient setting? Or is this a less stable situation and I need more help? We need a team monitoring this patient to make sure that we're not declining. Those adverse outcomes are not happening. So when we're thinking about the boards exams, we always want to think about the spectrum of stability because safety is going to be the number one thing that the ANCC, ANP is going to make sure that you understand because we want to make sure we're keeping our patients safe. We cannot go beyond our scope of practice. We cannot go beyond our setting. We want to make sure that we understand when a patient is appropriate to manage an outpatient and when a patient is appropriate to refer in or send in for more acute inpatient monitoring. This is really important. When I ask my students to really tell me, I'm going through the exam questions with them, and they answer a question incorrectly, I say, well, would you realistically in an outpatient setting do this? Right? Remember, you're in an outpatient setting. You're not in a hospital setting anymore. You don't have those resources. So in an outpatient setting, would you really send a patient home on this regimen and trust that they will feel fine, they will do fine, and they're going to survive? Or is that a risky patient that you need to refer 911, refer them to the hospital? They need to be admitted. They need to be on the inpatient side. So the spectrum of stability is really important to understand. We get into dicey waters when we have middle of the road patients in real life, but on the boards, they're going to give you pretty clear cut whether the patient is stable or unstable. So when you're thinking about these questions, these clinical scenarios, these clinical vignettes that they give you, I want you to be thinking about the spectrum of stability. Is this a patient that I can manage in the outpatient setting? Are these findings expected? Is this a chronic condition? These labs are pretty consistent with this chronic condition that I expected. It's unchanging. This patient is stable. that is a patient you can manage in that outpatient setting. Is this a new onset? This patient, we're not quite sure. They have some acute symptoms, some change in conditions, maybe unexpected. This is going to be a more unstable patient, right? This is a patient where on that spectrum of stability, we're going to need some additional help. We're not going to send them home to potentially have adverse outcomes, which is death and dying, right? That's the worst outcome, right? And with all that, we're going to use that NP process. So both boards exams focus on this NP process, doing our assessment, coming up with our list of differentials. Based on our top list of differentials, our top diagnosis, we're going to come up with the appropriate plan, implement it and evaluate that plan and make sure it's effective. If it's not effective, we're going to adjust it, right? So this is our NP process through and through. Now, what I really also want to emphasize is avoiding doing too much, right? So we have certain cases where if we're being too invasive, then that can also lead to adverse outcomes, infections. Definitely, we don't want to be doing too much, but we don't want to be doing too little either, right? So it's a fine line of figuring out how do we start based on our top differential diagnosis. How do we start this patient on a plan? What's the appropriate plan that's not too invasive, but I'm not also ignoring doing anything and just saying, okay, well, you have pain. Let's see what happens in a couple of weeks, come back, right? We're doing something for the patient, but we're not going to be so invasive about it. So if there's something you can do it. Don't ignore a problem. That's really important. Even if that means that you don't know what it is, but you know that something needs to be done, you either need to collaborate and get a specialist involved or send that patient over on the inpatient side to do some further investigation, do stat lab, stat imaging to confirm your suspicions, confirm or rule out your suspicions, and make sure that patient gets what they need. So that's really important. We don't want to just do nothing. So some of the exam questions I always tell my students, when you're looking at patterns, look to see, are some of them just doing nothing? Right? And sometimes that can be the most dangerous thing that we do, right? So if there's something you can do, make sure you help that patient, even if that means you're getting them to another specialist because it's just out of your scope of practice, right? We don't want to ignore things. But then when we are implementing a plan, we always want to start with the least invasive choice first. So just like pharmacology, start low and go slow, we want to do that with our interventions, our non-pharmacologic interventions as well. So don't go beyond your scope of practice. And then lastly, always visualize the scenario. So when they give you a clinical vignette, I want you to picture that scenario in your head. Picture that patient in front of you in the office. What would you actually realistically be doing for that patient? So answer those questions in your own words. I always tell my students that before you even look at the answer choices. Now let's talk about creating that focused study approach. I really want you guys to use your studying as an opportunity to identify those areas that you don't understand and create a study plan based on those knowledge gaps. And that's what we do here at Archer for our students. One-on-one, we work with you, we assess you, and then we find out, we tease out those knowledge gaps and create a focused study plan that really helps you with those knowledge gaps. So you always want to have a goal in mind of a test date. You can always push it back or pull it forward based on how you're doing in your progress, but you never want to cram. You always want to have a goal in mind and then work backwards from that goal. So, okay, these are the different body systems, the areas that I need to work on. How long do I realistically need from that test date? And is it realistic without cramming, right? Set one day for each topic and make sure you're focusing on that topic that day. So your exam questions are related to that topic that day and focus on those subjects. And if you need more time, you can push that test date back. But if you find that you're understanding it, you're seeing some progress on those readiness assessments, then you can always pull it forward again. Spend time setting the biggest topics on the test. So I talk a lot about this test is about outpatient primary care. Let's think about what do we see in that outpatient primary care setting. Let's focus on studying in those commonly seen chronic diseases or acute and chronic diseases. So that's what you want to really do. Focus your time on those biggest topics that are going to be tested. And then those smaller sections you can leave for the end. You don't want to not study them at all because they will pop up and it'll, if you see it, you'll get nervous on testing and be like, oh, I didn't study that at all. There's always going to be something that you didn't study, you don't know. But you want to make sure that you fit in those smaller topics towards the end as well. And you can always review the things that you know towards the end as well. But don't cram. And then if you know something, move on to something else that you don't know, right? And you can save that last week of studying to really review your notes, things you know, those sticky subjects, those sticky points, but really creating a focused study plan on the information that you don't know initially, and spending most of the bulk of your time there is going to serve you best. So key takeaways: spend more time breaking down those test questions. Don't rush through it, especially when you're studying. That's your time to really spend time and break it down. I usually tell my students no more than 25 questions a day when you're starting your study, because I really want you to use your time meaningfully with those 25 questions. That's really important. And look at each answer one at a time. So always answer it in your own words, and then look at each answer choice one by one. Eliminate the ones that don't fall into what you would do in that clinical scenario, and don't change your answer. Trust your instinct, go with that first one. The biggest thing is practice regularly, right? Even if it's not a large volume, it's not about quantity, but it's about quality. So those 25 questions, I want you to try to be consistent with doing them. Of course, give yourself break days. You need to make sure that you're not burning yourself out. But I want you to be consistent about using practice questions. And research shows that those practice questions are the best way to learn. So there are a lot of different tactics. People like to highlight, people like to make their own flashcards, note cards, but practice questions are the most effective way to learn topics that we don't already know. And the reason for that is because we learn a lot from those rationales. We go back and we study those areas that we don't understand based on what we got right or wrong on that practice question. So really, really effective. And so with that, I wanted to show you guys what we have here at Archer for our practice questions. The free demo you can go play around with. But I'm going to show you guys my student dashboard that I love to show my students when I'm tutoring, just to play around with it and see how fun it is, how interactive, how user-friendly. So when you first sign up, you'll see if you sign up for our SurePass, which gives you access to our QBank, our on-demand videos, as well as our 3-day live review, you'll see all these different things. So in our QBank, what I really like is if you want to create a practice question, this is our readiness assessment. So this is what I always tell my students to start off with, because this will really tell you where you stand. And when you're working with us one-on-one, we can help you tease out those areas that you really need to focus on. But if you're doing it on your own and you feel confident creating that study plan on your own, this readiness assessment really helps break down those different areas. You can pick which test type you're preparing for. The length of the test is only 75 questions, but it includes everything. And you can really go through and see how you're doing on different subjects. It'll give you, at the end of the day, it'll give you the analysis, and I'll show you what that looks like. So when you answer the question right away, this is a readiness assessment, so it'll just go through the questions. When you end the exam, so you can do end test, it'll give you, and I'll show you, it'll give you your results. And so it'll give you the statistics, it'll give you all the questions, you can go back and forth. It gives you the subject and the lesson, which is really nice. And what that means is you can really start to tease out, okay, am I getting mostly geriatric questions wrong, pediatric? Is it more neuro? You can really tease out those areas of knowledge gap and build your study plan out from that. It also gives you the difficulty level of the test question and how long it took you to answer that question. And then we also interpret your readiness. So our SurePass method, if you score high or very high on 4 consecutive readiness assessments, then you are ready to take your boards. And that's a really good feeling, knowing that, okay, this is going to be successful because I've been putting in the work and I've been seeing the progress on my readiness assessments and I'm getting there. So for those of you who are in that low or borderline, how can we improve? So when we go through our study plan, I always tell people focused study plans, that's what we want. So say we're going to focus 25 questions a day and we're sitting for the ANCC, we're always going to use the unused in our question bank. And I'm going to do adult pharmacology on this day, right? We're going to go next. And then you can do all or focus on, you know what? I want to focus on just cardiovascular today and go and create the test. Now you have really focused in that area. And when you answer the question, it'll reveal the answer for you in that tutorial mode and it'll give you those rationales along with the videos. And that's why I always tell people SurePass is really the most effective package. It's the most bang for your buck too, because it gives you access to our Q bank and our on-demand videos and our on-demand 3-day live review. So you get everything in one package for a really good deal. And you can see that video takes you right to that section where it's pertinent to this test question. And you want to read through the rationale. And it also gives you the statistics in this tutorial mode where it talks about that difficulty level, talks about the subject, and how long it took you. And you can go to the next one and do the same thing. So when you go through this in your focused studying, that's why it's going to take you all day to just go through 25 questions. Because when you answer, you want to take the time and say, okay, did I get this right? Did I get this wrong? Even the ones you got right, you want to read through those rationales and make sure you understand you got it right, not just by luck, and your knowledge is accurate. And watch that little clip of the video. Now, once we end the test, again, we do have the statistics and the results. So same thing, you can go through and see all your results. You can filter by incorrect or correct answers. And then you can go through our on-demand videos and see all of those videos and watch those during your studying before you take those questions too. Don't wait to take the questions again. Statistics shows using those practice questions, most effective way to study. But these on-demand videos are really helpful because we have everything from pharmacology to professional role, to endocrinology, cardiovascular. And then if you do the SurePass, you have our on-demand 3-day live review. And you can save that for the last couple of weeks before you sit, because this is really high level review of making sure you've hit all those topics. And if there are any knowledge gaps left, you can go back and review those. We also have really nice, advanced clinical skills videos in here too. And these were filmed in a sim lab by Doctors Taylor and Caffrey. It's Dr. Heaps now. I kind of get mixed up on Annie's last name, but she got married just a few months ago. So they recorded these on-demand videos in our sim lab, and these are really high level, head to toe. It goes through everything from a speculum exam to suture removal to wart removal. So these are really nice for not only getting ready for the boards, but also your clinical practice, especially for those who may not feel as confident in those areas. But I really like these Q banks. So best thing to do is really study those practice questions, practice while you're studying with practice questions. You're going to learn a lot from that. And that's what the statistics shows. And so we have a lot of different packages that can help you get there. But if you're just feeling like, Kiva, I don't know where to start, I'm not feeling confident at all, I need some help, we have mentoring and tutoring with myself and with my colleagues. And this is something that I really enjoy doing, working with my students one-on-one. I've had a lot of success with students who have failed the boards in the past, and they've tried a lot of different products. They come to me, and having that human real life experience with an educator is so different when you're creating that study plan. It really leads to a lot of progress and success. And I get really excited with my students when we work together and we have passed. So don't hesitate to reach out to me. If you're just not sure yet, email me, nursepractitioner@archerreview.com. Come straight to me, and I would love to hear from you. I would love to support you, and I want to make sure you guys know that this community exists. You're not alone, and you can absolutely turn those setbacks into comebacks. So I'm going to hang out for a few more minutes. You guys ask your questions in the chat for me if you haven't already, but thank you so much for everyone who joined today. I see a lot of messages saying I need one-to-one review. Definitely scan this QR code or go to our website. You can also check out our tutoring. So right now I'm logged in to show you guys the dashboard, but if I wasn't logged in, you guys would see on our website, so Archer Review, you can just go right to the tutoring page and it will show you, let's do nurse practitioner. Actually, easier way to get there is we go to Archer Review Nursing and we'll have tutoring right here, nurse practitioner. And we're playing around with our website. So you guys also give me feedback on our website because we're definitely growing and expanding, offering a lot more things that we didn't have before. So here you can go to that private tutoring. And if you hit book now, you can see the availability for the next couple of weeks, those little dots of what's available going into September and the following months. And I'd love to work with you one-on-one. So thank you for those who joined us today. Absolutely reach out to either myself or my colleagues to really schedule that one-on-one, and we will get you guys turned around and back on a focused study plan, seeing results, seeing progress, and getting over this hurdle. Remember, you guys are already going to be awesome clinicians. This is just a box to check off and make sure that you enter clinical practice knowing that you are confident and competent to treat your patients, because you are. So thank you so much, you guys. Make sure you reach out to me and ask any questions you have today. I'd love to hear from you, and enjoy the rest of your Monday.